Welcome everyone, and thank you for joining us for the 2021 State Capitol Day event. My name is Sarah Allen. I'm the North Texas and Oklahoma Area Director for the American Foundation for Suicide Prevention. And I'm joined here today by Cammie and Jane, who are also Area Directors for AFSP that you'll hear from later, as well as Kaylin Sisk, who is the Chair of our Texas State Capitol Day Committee. Now, before we get started, we want to hear where you're from. So we're going to launch a poll. It just popped up. Please refer to the map on the screen to help you identify which chapter you're in. And also feel free to type a quick hello in the chat, as well as where you're joining us from. We'd love to hear from you. Just a couple of housekeeping items before we get started. Everyone will be muted for the duration of the call. The call is being recorded, and we will share that recording with you either later tonight or tomorrow morning. And we will have a Q&A portion at the end of the meeting where you can unmute and ask any questions. Just have a few more people that need to answer the poll, and then we will get moving on. Awesome. Thank you, everyone, for answering. We'll share those results. Looks like we've got a good mix of people. So we're honored to be able to hear from a few different people. We already mentioned once that you'll hear from the other Texas area directors. You'll hear from Kaylin Sisk, as well as the Honorable James Tallarico, Texas Representative District 52. During tonight's event, we'll go through basic suicide facts and figures and Advocacy 101 training. We'll review this year's Texas policy priorities, discuss next steps for taking action, and then take some time for question and answers. Please note that all participants will be muted. Once again, you feel free to ask questions in that chat box or following the presentation. So now a few opening remarks from the Honorable James Tallarico, Texas Representative, District 52.
Hi, this is James Tallarico, State Representative for House District 52. I just wanted to welcome all of you to the AFSP Advocacy Day here at the Texas Capitol. I wish I could be spending time with you in person, but given the pandemic, we're trying to be as safe as we can. And so I'm welcoming you to your virtual advocacy. And I just want to tell you how proud and thankful I am for your organization and suicide prevention advocates from around our state. They are some of the bravest activists that I've ever had the privilege of working with, many of whom have had personal experiences with suicide and have lost family members to suicide, yet they find the courage and strength to transform that deep pain into something new, something creative, and something beautiful. I want to thank you for everything you do for our state, and I want to tell you that I'm looking forward to working with you on suicide prevention legislation this session, particularly on expanding mental health services throughout our K-12 school system. Thank you for all you do, and have a great Advocacy Day.
And now I want to introduce Cammie Hazine, the South and Southeast Texas Area Director for AFSP, as she takes us through some basic suicide facts and figures.
Hi, everyone. Thank you so much for being here. We know that when we talk about suicide, it's going to be really important for us to use safe messaging. We know that you all are coming to us from many different backgrounds, whether it be that you lost a loved one to suicide, or maybe you've had your own struggles, or might be supporting someone who's struggling. So telling your story, we know, can save lives, but only if you share it safely. So we're just going to if you want to look at the slides, and I'll kind of talk through them. Just a word about our language do's and don'ts. We know that the words that we say matter, and that's especially true for suicide. So we really want to avoid saying the words commit suicide. Instead, we want to say that someone died by suicide, or they ended his or her life, or they killed himself or herself. We also want to avoid saying the words failed or successful attempt. Rather, we want to say it was a suicide attempt or death by suicide. For anybody that's been through one of our Talk Saves Lives presentations, when we talk about suicide, we know that largely suicide is preventable. We know that suicide is also a health issue. So I want you all to think about suicide the same way that you would think about a heart attack or cancer or diabetes. It's a health issue. So in the same way that we would never say that somebody committed cancer or they committed a heart attack, that's kind of why we want to stay away from the word commit suicide. Just some other notes. We want to make sure that you're in a safe place to be able to share your stories. We want to avoid details about the method. This could be triggering for those around you. We also want to we want to empower you all to share the National Suicide Prevention Lifeline or the crisis text line. And lastly, we want you to practice. So the more comfortable you are in sharing your story and talking about it, that can help us break the stigma associated with mental health and suicide. So here are just some numbers, and I know there's a lot of numbers here, so we don't want to overwhelm you with all of the data. And I also want to assure you that you don't need to have all of these memorized and be able to spit them out as you're talking to someone. Maybe pick one or two that resonate with you, and maybe that you can incorporate those into your story. One of the statistics that I use a lot when I'm talking about suicide, or especially suicide in Texas, is that it's the second leading cause of death for young people ages 10 to 34. Many times I'm a parent myself, and to me that resonates with me. If you really think about that age group from 10 to 34, the second leading cause of death. So again, I don't want to overwhelm you all with all of the numbers. You can look on your screen to kind of see those stats, but maybe pick one or two, or one is just fine that feel good and that you can incorporate into your story. Here you'll see is a map. This is part of our national fact sheet, and it's available on our website at afsp.org/statistics. And you're just seeing a comparison rate of suicide rates across the country. What we can see on the map, or I don't know if you can see because it's kind of small, that Texas is in the lower third. Even though our numbers look better comparatively, there's still a lot of work to be done. We know that every 2 hours a Texan dies by suicide, and that is why we're here. That's why you're here. We want to make a difference. We want to help educate people. And then here's our Texas numbers. So the numbers that you are seeing are CDC numbers, and these are collected every year, and it typically takes a little while for this data to be published and then shared with us. So you're looking at 2019 numbers. Suicide still remains the second leading cause of death. Again, to that first slide, 10 to 34. When I first started at AFSP about 2.5 years ago, that age was 15 to 34. So just in a short period of time, we're seeing younger kids being affected. So the work that we're doing today matters, and we just thank you a lot. And I'm going to hand it over to Jane, our Central and West Texas Area Director.
Hello, everyone. I hope you're all having a great evening, and thank you for spending some time with us today. So to get a better idea of where we are and how comfortable you are talking about advocacy, we're going to launch another poll to see how comfortable you are right now before we dive into this section. So please feel free to answer how comfortable are you talking about advocacy in the state of Texas? All right, we've still got some votes coming in. Looks like we've got a few more people. We'll give it another second or two. Okay, So it looks like most of us feel slightly comfortable, and hopefully we'll be able to help you feel more comfortable today. So why advocacy? By advocating for the issues that we care about, like suicide prevention and mental health, you can make a difference. AFSP provides advocates the opportunity to share your story and to make connections with lawmakers at both the federal and the state level. And we also have a platform. The AFSP Action Center is where we can email legislators directly. Advocates can also advocate in the future at some in-person events locally as well as across the country. Typically, this event is held in person, but of course, as you know, we're meeting virtually today because of COVID-19. AFSP volunteer field advocates make an impact in many different policy areas for suicide prevention and mental health. The policy priorities that we have are determined by our National AFSP Public Policy Council, as well as our Public Policy Office staff in DC, and those are determined every 2 years. And our staff, they work with the chapters to determine where the gaps are and which policies will make the biggest impact for each individual state. So you can actually find those policies at any time at afsp.org/priorities. And you'll find more detailed information on our top policy issues and to view and download our full list of priorities for the next 2 years, which covers 2021 and 2022 public policy synopsis. For those who may be new to advocacy, we want to address the question, where does legislation come from? It comes from our legislators themselves, and it's based on their own personal stories and their passions and interests. And it also comes from you as advocates and as constituents. And then it also comes from organizations like AFSP that work directly with legislators and other leading mental health organizations to write new policy and provide resources to support future legislation. So how exactly does a bill become a law? Once a legislator has an idea for a bill, they'll draft language and introduce it. Once it's introduced, the legislation is assigned to the relevant committee within the House of Origin, so either the House or the Senate. For example, if you're working with a senator to introduce a bill to have all teachers trained in suicide prevention, that bill's House of Origin is the Senate, and the bill will be sent to the Senate Education Committee. At that time, the committee has the opportunity to review, edit, vote, and approve the bill's language before sending it to the floor for a full vote. If the bill is voted favorably, it will then go to the other house. So with our teacher training bill example, if it's approved by the Senate Education Committee, it would then go on to be voted by the Senate. And if the Senate votes for it favorably, it would go to the House and it would go through the same committee review and floor voting process. And only when a bill has been voted on favorably, both in the House and the Senate, can it go to the governor's desk to be signed into law. Once received by the governor's office, the governor typically has a set number of days to act on the bill by signing it or by vetoing all parts of the bill or sending it back to the House and Senate for additional edits or recommendations. And there are some states where the governor can also choose not to sign or veto the bill and can instead allow the bill to become law without a signature. Now let's talk about how we as advocates can connect with our lawmakers. When speaking to a legislator or to a staff person of a legislator, you want to be polite and you want to thank them for their time. You also want to be mindful of the language that you use, and you want to use the language that Cami talked to us about. And you want to be sure that you're sharing your connection to the cause. Think of it as an elevator pitch, and you don't have to share many details if you don't want to. I'll share my story as an example. Hi, I'm Jane, and I've been affected by suicide through the loss of a family member, my own struggle, and by supporting several people in my life who have all struggled with thoughts of suicide. I look forward to sharing more information with you about the local AFSP chapter and how we can work together to prevent this leading cause of death. I'm also happy to answer any questions you may have. So in your communication with a legislative office, if you don't know the answers to their questions, that's okay. You can say, I don't know the answer to that right now, but I'd be happy to follow up with you as soon as I do. And that also provides an excellent opportunity to maintain communication with that office for further position yourself as a resource. So let's talk about how you become a resource. There are a lot of ways to build relationships and to stay connected with your lawmakers through the year. You can email and call them through the AFSP Action Center. You can tag them in social media posts or meet with them or their staff virtually over phone or by video. And you can sign up for their newsletters so that you know when they're hosting town halls or other events in the area. And many town halls and legislative meetings now are being held virtually, which offers an increased opportunity for advocates to become engaged in the legislative process. So as you begin your advocacy journey, it is important to know what resources you have at your disposal. The state legislative website offers several resources to advocates. This is where you can identify who your legislator is and how to contact them. You can also see what laws are currently enacted and search for legislation that has been introduced in the current legislative session. Advocates can also sign up for the newsletters that we talked about, and you can find out what relevant events and advocacy opportunities may be coming up in your area. So if you're interested in learning more about the specific policy areas that AFSP works on at both the federal and the state level, there are several resources available for you. The Public Policy Office has hosted and shared policy-specific webinars, filmed sample meeting videos for new advocates, and created issue briefs for each policy area that explain AFSP's policy position and show what laws are in place in each state. You can also visit the AFSP Action Center at any time to see what legislation AFSP supports and where bills are in the legislative process. So if you want to just take a quick second and jot down the URLs that you're seeing on the screen now, and you can find resources here to help you. And with that, I would like to turn it over to Kaylin Sisk to talk about our Texas state policy priorities.
Hi, everyone. Before we begin, I'd like to share that our public policy team informed us that this year, more than any other year, Texas has a lot of bills relevant to mental health and suicide prevention, which is great news, because that means mental health and suicide prevention are being recognized as important issues by lawmakers. Our public policy team worked really hard to narrow things down to top issues in 3 key priority areas to focus on for this event. The first priority area is access to crisis services and mental health care. And before we begin, let's talk a little bit about the background on crisis lines. The National Suicide Prevention Lifeline, or Lifeline, is a national network of state and local crisis centers linked through a 24/7 toll-free number. I'm sure most all of us have heard this number, 1-800-273-TALK. This connects callers throughout the US to immediate crisis care. Callers are connected with a call center in their own state. If the local center is unable to answer, the Lifeline reroutes the calls to one of 9 backup centers in their network, which may be in or out of state for the caller. Statewide crisis lines help to ensure that gaps in local services and delivery areas are served and that calls are answered 24/7 by individuals who are trained to handle suicide risk and other mental health crises. Although the Lifeline has proven itself to be an essential and necessary component of the suicide prevention and mental health care system, the network of crisis centers consistently faces two main interconnected barriers to its effectiveness and success. First, insufficient funding, and second, limited capacity to respond to increasing call volume. While the Lifeline is a national program, our federal funding goes mainly toward managing call routing, best practice standards, public messaging, and technical assistance. The local centers rely on funding from state and local contributors to operate and to grow their centers and meet that call volume. It's critical for state governments to provide funding to these local crisis centers within the Lifeline network to make sure that calls are answered in state. As you may have heard, in October of last year, the National Suicide Hotline Designation Act became law, which designates 988 as the future 3-digit phone number for the Lifeline. It requires full implementation and access of 988 by July of 2022. And it empowers states to enact laws allowing for 988 to be funded the same way as 911 through monthly customer service fees. Full implementation of 988 is projected to result in a large increase in call volumes. Timely access to mental health and crisis services can save lives, and AFSP urges every state, including Texas, to pass legislation enacting customer service fees for 988. Yesterday, it was explained so well to me. When you get your phone bill and you see that 911 service number at the bottom of your phone bill, we are asking for the same type of service fee for 988 to help provide this funding that local call centers need. This funding will ensure call centers have the capacity to answer increased call volume, that callers can be connected 24/7 with a center in their own state, and that call centers are equipped with the resources to connect callers with wraparound services and care. For your reference, here's a listing of crisis lines, including the Lifeline. The National Suicide Prevention Lifeline offers phone and chat support 24/7. The Crisis Text Line offers text support available 24/7. The Trevor Lifeline, or Trevor Chat, offers phone, chat, and text support for LGBTQ youth. Trans Lifeline offers phone support for transgender people, by transgender people. And Sage LGBT Elder Hotline offers peer support and resources for older LGBTQ adults, available 24/7. Next, we'll move on to House Bill 1050 and Senate Bill 539. In summary, this study will look at utilizing crisis teams to respond to behavioral health emergencies, and if it's effective in reducing the incarceration of individuals with substance use disorder, developmental disabilities, or mental illness. Results from studies like this can often be used as evidence to draft future legislation. Priority area number 2, student suicide prevention, intervention, and postvention. House Bill 1014 will require ID cards issued to public and private school students in grades 6 through 12 and college students to contain the contact info for the National Suicide Prevention Lifeline and the Crisis Text Line. It also allows for the inclusion of local suicide prevention hotline, as well as contact information for a college campus's police or security and the campus health clinic. Students must be equipped with the tools to reach out should a mental health or suicidal crisis occur. Transparency and easily accessible info can reduce the stigma surrounding mental health conditions and reinforce the notion that it is a sign of strength to seek help. By offering immediate help to everyone that needs it, crisis lines provide invaluable support at critical times. AFSP supports efforts to include the number 4 National Suicide Prevention Lifeline and other local crisis services on all student ID cards in K through 12 schools and institutions of higher education. Now, as I go through these, you guys remember you don't have to know these verbatim. There are notes and there's a policy brief, but I would suggest taking notes on things that stand out to you. House Bill 3300. Existing law requires training for educators on suicide prevention and recognizing signs of mental health conditions and substance abuse. This bill would require that this training occur on a biennial basis. Existing law requires student health curriculum to include mental health and suicide prevention. This bill would clarify that relationship between substance use and suicide. This bill would clarify that the relationship between substance use and suicide, recognizing warning signs, and seeking help and accessing community services must be covered in that curriculum. House Bill 2954 and Senate Bill 980 requires the Texas Education Agency, if the funds are appropriated, to establish a suicide prevention, intervention, and postvention program for school districts. This program would be optional and available for districts as they need them. School personnel interact with children and teens daily. They're in a prime position to recognize the warning signs and risk factors of mental health conditions and suicide risk, and to make referrals for help. Training equips educators with skills and confidence to recognize these signs and act accordingly. And similar to refreshers in CPR, suicide prevention training should be a part of routine educator training and recertification. Youth suicide can be prevented through early detection of students who may be in crisis or struggling with their mental health. Educating students on signs and symptoms of mental health conditions and suicide risk can empower them to know when and how to reach out for help for themselves or for their peers. Transparency and easily accessible info can reduce the stigma again. Priority area number 3, suicide prevention training for health professionals. House Bill 1384 requires training that must cover suicide screening and referral and may include assessment, treatment, and management. This bill requires physicians, chiropractors, physician's assistants, nurses, and physical therapists to complete 1 hour of training as a condition of their license renewal. It requires practitioners such as occupational therapists, chemical dependency counselors, marriage and family therapists, professional counselors, psychologists, and social workers to complete 6 hours of training. I think that it's important to note that while these practitioners are required a certain number of CEUs for license renewal, it is not specific to suicide prevention, assessment, treatment, or management. This bill specifies that these 1 or 6 hours must cover suicide screening and referral. Health professionals and professionals in training regularly encounter patients who are at risk for suicide, but patients often don't express suicidal thoughts directly. Across the US, in the month prior to their death, 45% of people who died by suicide had contact with a primary care physician, and 19% had contact with mental health services. In the year prior to their death, 77% of people who died by suicide had contact with a primary care physician, and 32% had contact with mental health services. This tells us that connecting individuals struggling with their mental health to quality healthcare is a vital component in preventing self-harm and possible death by suicide. Many primary care and mental health professionals and professionals in training are unprepared to assess, treat, and manage suicide risk, as this is not a routine part of their training or continuing education. Gatekeepers, or people trained in suicide prevention, like teachers, parents, clergy, and first responders, are typically trained to refer persons at risk for suicide to a health professional. So it follows that health professionals need to be equipped to handle those referrals. Your screen ahead of me. AFSP supports requirements to regularly train primary care and mental health professionals in suicide assessment, treatment, and management. Training health professionals in the most current suicide prevention standards increases provider competence in training in treating suicidal people and updates professionals on the most effective evidence-based treatment options. Suicide-specific training enhances the level of care that people at risk for suicide receive, while also increasing provider competence and ability to provide effective, life-saving treatment. Now, as I mentioned earlier, there are a lot of relevant bills in play right now. On this next slide, there are some bills that you may be interested in learning more about. As you get to know your local representative and the issues that are important to them, you may find that one of these bills may be of unique interest to them. So feel free to connect with us offline to learn more. Again, our public policy team worked really hard to narrow all of this down to some key priority areas for us to focus on for this particular event. But feel free to reach out about any of these other bills if they're of interest to you. Whew. Those public policy priorities, take it out of you. There's a lot of those. Action items for this week. Let's get excited about taking action this week. I'm going to run through these and then go into detail on a few of these in the upcoming slides. This week, email your legislators via the AFSP Action Center, schedule a phone meeting with the legislative office, share your connection to the cause through a vignette. You can engage your community by recruiting other advocates, and be sure to promote suicide prevention on social media by tagging AFSP National and hashtag AFSP Advocacy, as well as your legislators. An easy way to email your legislators is through our AFSP Action Center. Our public policy office makes it so easy to be able to contact your elected officials. If you visit afsp.org/action center, you'll be prompted to fill in some basic information about your name and your address, and you will be connected with your representatives. It will automatically populate whose district you're in and who your officials are, and what public policy priorities need action. It literally takes 2.5 minutes. It's super simple, super easy. This week, when you call your legislators, or if you call your legislators, introduce yourself and your connection to the cause. Utilize the issue brief. Highlight an issue that you feel passionate about, or possibly one of interest to your representative. Share your chapter information. And let me offer you a couple of reminders. Your legislators and their staff are human, just like you and I. They don't expect you to be an expert. I quite obviously am not an expert in advocacy or public policy, but they value the information that you're offering, and they want to know what's important to their constituents. If you don't know the answer to a question, again, just tell them that you don't know, but you will find out. We have an amazing public policy team that is a great resource for us and will provide you the answer. I also want to share that when I first began with advocacy, I was a little nervous about how lawmakers might respond to my story or suicide loss. But I quickly realized that the more often that I spoke with staffers and legislators, unfortunately, the people that I met with more often than not had a connection as well. And that sharing my story often created a connection and opened up a dialogue for a really great discussion. So I encourage all of you to talk to your legislators and their staff just like they're a friend. They're just human. Don't be nervous. If anything, it's the most empowering thing that you will do. After your meeting, be sure to send them a thank you email and include your vignette. This is an example of a vignette. I believe in the resources file, you can find yours, or you can find a template and create yours. It's great to share dates of upcoming chapter events, and you can even invite them to join upcoming walks. Talk saves lives. And also offer to be a resource. Again, schedule your phone meetings to take place this week. Make sure you complete a legislative meeting feedback form after your meeting. Don't forget to send a thank you email to the office. And then on Friday, we hope that you'll join us for a debrief. We can share our what we learned, highlights of our meetings, things like that. And if you have any questions or you need assistance, feel free to reach out to texas@afsp.org. That's our event email.
Thank you so much, Kaylin. So just a couple of other things. Kaylin mentioned inviting a legislator to attend an event. Here are some upcoming events that all of the Texas chapters have coming up. There are some 5K runs, there's campus walks, there's also a multitude of trainings that are coming, including May. Cammie, Jane, and I are working on a full slate of mental health trainings, both in English and Spanish. So whichever chapter you're in, I encourage you to sign up for the emails at the URL that are listed, follow us on Facebook, and just stay connected to all of those events that are coming up.